Welcome to Elderly Care and Advice channel, and thanks for watching our video. We appreciate you. Have you ever thought that something as sweet and natural as sex could become risky when you grow old? Yes, you heard that right. Many people believe sex is always good, no matter your age. But what if I told you that regular sex in your senior years could actually cause harm to your health? This may sound surprising, even shocking. But it's true. As we get older, our bodies change. The heart becomes slower. The bones become weaker. The skin becomes thinner. Things we once did with ease may now be harder, even dangerous. But nobody talks about this. Most seniors still try to live as they did in their younger days. And that includes sex. They think it's a sign of love, strength, or youth. But if you don't know the risks, you may be putting your health in danger without even realizing it. This video is not to make you feel bad. It's not to shame anyone. In fact, it's the opposite. It's to help you understand your body better so you can enjoy your life without fear or pain. In today's video, we will talk about 5 bad sides of regular sex for seniors. These points may surprise you, but knowing them can help you make better choices, stay healthy, and live longer. If you're over 60, or you care about someone who is, this video could change everything. So sit back, listen carefully, and let's begin. Before we begin, please, I would appreciate it if you like this video. You can help me continue to spread the age-old lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell notification so I can be motivated to make another video as quick as possible, and you don't miss any of my videos this week. If you like this video, please kindly comment, yes. If you don't like it, comment, no, to let me know so I can make another better video for you this week. Now, let's get started. 1. Heart problems. Sex may seem like a fun and loving act, but it is also a kind of exercise. During sex, your heart beats faster. Your blood pressure rises. Your breathing becomes heavier. All of this puts extra work on your heart. When you are young, your heart is strong. It can handle this extra work. But as you grow older, things change. Many seniors have heart issues like high blood pressure, blocked arteries, or weak heart muscles. These problems make it harder for the heart to do its job. Now imagine this. You are 70 years old. You have high blood pressure and diabetes. You feel fine during the day. But during sex, your heart starts working faster. Suddenly, you feel chest pain. Or you get dizzy. Or you can't breathe well. This could be the early sign of a heart attack. Sadly, many seniors ignore these warning signs. Some feel too shy to talk about it. Others think it's just part of getting old. But the truth is this: sex can trigger a heart problem if your body is not ready. Dr. Donald Paul explains. For many older people, sex is safe if the heart is healthy. But if you already have heart disease, even light activity can cause serious issues. Always talk to your doctor first. Real-life example. Mr. Joe, age 72, thought everything was fine. But one night after sex, he suddenly felt very tired and short of breath. His wife took him to the hospital. The doctor said he had a mild heart attack. He didn't even know his heart was weak. What you should do? Get a heart checkup before having regular sex. Don't eat heavy food before sex. Take it slow, there's no need to rush. If you feel chest pain, stop right away. Rest and don't push yourself too hard. Your heart is your engine. If it fails, everything else fails too. Treat it with care. 2. Joint and muscle pain. As people grow older, the body begins to slow down. The bones lose strength. The muscles become weaker. The joints, like the knees, hips, and back, become stiff or painful. This is a normal part of aging, but many seniors still try to move like they did when they were young. Now, here's the truth. Sex requires body movement. Sometimes it's gentle. Other times it involves bending, turning, or stretching. For seniors, these movements can easily cause pain in the back, hips, or legs, especially if the body isn't warmed up or supported properly. Even simple positions can be difficult for someone with arthritis, osteoporosis, or weak muscles. The pain may not come right away, but later that night, or the next day, you may feel sore or even unable to walk properly. Real-life story. Auntie Rose, 68 years old, had a little back pain but ignored it. One night, she and her husband tried a new position during sex. At first, she was okay. But the next morning, she couldn't bend or stand straight. The pain was sharp. Her doctor said she had strained a muscle and needed rest for 2 weeks. She also needed to use a walking stick to move around. Dr. Donald Paul advises, older adults should not copy what they see on TV or in magazines. The body changes with age. Comfort and safety must come first. Helpful tips. Choose soft surfaces, like a strong mattress. Avoid cold, hard floors or tight spaces. Use pillows to support your knees, back, or neck. Try gentle, slow movements. Stop immediately if you feel pain, discomfort, or pressure. Remember, sex is not a sport. It should not leave you feeling hurt or broken. Your body needs love, not stress. With the right care and patience, you can enjoy closeness without hurting your joints or muscles. If you're still watching this video and finding these insights valuable, please comment yes below to let me know you're here. Please, if you haven't subscribed yet, I recommend you subscribe and turn on the bell notification so you don't miss any of our videos. Your support by promoting this video, subscribe, likes, and share helps us motivated and continue creating good content to inform and inspire you every week. Now, let's move forward. 3. Urinary tract infections. Urinary tract infections, or UTIs, are very common in older people, especially women. A UTI happens when bacteria enter the urinary tract. That's the area where we pass urine. These bacteria cause pain, burning, and sometimes fever. Now, how does sex cause this problem? During sex, the private parts rub together. This rubbing can push bacteria into the body, especially if the area is not cleaned properly. In younger people, the body fights off the bacteria more easily. But in seniors, the body's defenses are weaker. That means bacteria can grow faster and cause more harm. For older women, the problem is even greater. After menopause, the body makes less of a hormone called estrogen. This change causes the skin around the private parts to become dry and thin. The natural protection against infection becomes weak. That's why UTIs happen more often in senior women. Real-life story. Mama Esther, 70 years old, started feeling pain while urinating a few days after sex with her husband. At first, she thought it was just normal aging. But soon, she had a fever and lower stomach pain. Her doctor said it was a urinary infection caused by bacteria from sex. Dr. Donald Paul explains, many seniors don't realize how easily infections can happen. Cleanliness and gentle care can go a long way in preventing UTIs. Tips to stay safe. Clean the private area with warm water and mild soap before and after sex. Always pass urine after sex. This helps wash out bacteria. Drink more water to flush the bladder. Avoid using strong soaps or scented products around private parts. See a doctor quickly if you feel burning, fever, or pain while urinating. UTIs can cause serious problems if not treated. But with good hygiene and smart habits, you can protect yourself and stay healthy. 4. Falls and accidents during sex. Sex is not just about emotions, it also involves movement. And for seniors, that movement can sometimes be risky. As we grow older, our balance becomes weaker. Our legs may shake, our knees may not be strong, and our reflexes slow down. This means that even small actions can lead to slips, trips, or painful falls. Sadly, many older people hurt themselves while trying to change positions, get up from the bed, or move on slippery floors. Sometimes, the excitement makes people forget their age. They try to act like they're still in their 20s. But the truth is, a simple fall during sex can break a bone, hurt the back, or even cause a head injury. Real-life story. Uncle Ben, 75 years old, tried to stand on his knees during sex. He lost his balance, fell off the bed, and hit his hip on the floor. The doctor later said he had a small fracture. He needed to use a walker for 3 months, and the injury left him scared of being close to his wife again. Dr. Donald Paul advises, the bed should be firm, wide, and safe. Avoid standing or doing anything that puts you off balance. One wrong move can cause months of pain. Safety tips to avoid accidents. Use a strong, low bed, not too high or too soft. Make sure the room has good lighting so you can see clearly. Keep the floor dry, no water or slippery rugs around. Use stable furniture for support if needed. Move slowly and gently, there's no need to rush. Remember, sex should bring closeness, not injuries. A fall at an older age is no joke, it can change your life in seconds. Be wise. Focus on safety and comfort more than speed or excitement. With the right care and setup, you can stay safe and still enjoy those special moments with your partner. If you're still watching this video and finding these insights valuable, please comment yes below to let me know you're here. Please, if you haven't subscribed yet, I recommend you subscribe and turn on the bell notification so you don't miss any of our videos. Your support by promoting this video, subscribe, likes, and share helps us motivated and continue creating good content to inform and inspire you every week. Now, let's move forward. 5. Emotional stress and pressure to perform. Sex is not just about the body, it also involves the mind and heart. For seniors, this can be both good and bad. Many older men and women feel pressure to perform during sex. They worry about things like, am I still strong enough? Will my partner be happy? Do I still have what it takes? These thoughts create emotional stress and take away the joy of being close. Also, aging can bring changes in how the body works. Some men may have trouble getting or keeping an erection. Some women may feel dry or uncomfortable. These are natural changes. But sadly, some seniors feel ashamed or frustrated. They think something is wrong with them. They start to avoid sex or feel less confident. Real-life story. Aunt Grace, 66, told her friend she felt scared each time her husband came close. Not because she didn't love him, but because she felt embarrassed. She didn't feel as attractive as before, and she thought she was not good enough in bed anymore. This made her feel sad and lonely. Dr. Donald Paul shares, older people must know that sex is not a test. It's about love, trust, and closeness. If it causes stress, then something needs to change. How to reduce emotional stress. Talk openly with your partner. Share your feelings without shame. Understand that bodies change with age. That's normal. Focus more on emotional connection, holding hands, cuddling, talking. Don't copy what you see in movies. Real love is simple and kind. If needed, talk to a doctor or counselor. It helps. Remember, love is not measured by how often or how perfect sex is. What matters most is the bond between you and your partner. With honesty, understanding, and care, you can enjoy a peaceful and loving relationship, even if your body changes with age. Recap and final thought. Let's take a quick look at what we've learned in this video. We talked about 5 bad sides of regular sex for seniors, not to scare anyone, but to help you stay informed, stay safe, and stay healthy. First, we looked at how sex can put stress on the heart. If your heart is weak, even small effort can be dangerous and may lead to a heart attack. Second, we learned that joints and muscles get tired faster with age. One wrong move can cause serious pain in your back, knees, or hips. Third, we spoke about urinary tract infections, UTIs. Bacteria can enter the body during sex, especially if hygiene is poor. Seniors, especially women, are more at risk. Fourth, we discussed the danger of falling during sex. Seniors can lose balance easily. A small fall can break a bone and cause months of pain and fear. Fifth, we explored the emotional pressure many seniors feel. Worrying about performing well can create sadness, stress, or even depression. Sex should bring joy, not fear. Growing old is not a curse. It's a blessing. And love doesn't have to end with age. You can still enjoy closeness, touch, and intimacy. But you must be wise. You must listen to your body. You must speak honestly with your partner. And most of all, you must choose safety over pressure. There is no shame in slowing down. There is no shame in being careful. True love grows with time, and it respects the body and the heart. Please drop a comment below this video with one thing you've taken away from this and how you plan to put it into practice in your life. Your story might just inspire someone else. If you like this video, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more tips to help you stay strong and savvy. Expect our next video this week. Take care of yourself. You're more resilient than you know. Thanks for watching.